On this, the very first episode of the No Pain podcast, I had the opportunity to interview my wife, Martina. We talk about her foot injury, what she's been doing to recover from it, and how it's impacted her life. It's a different perspective because she's actually a physical therapist herself. Have a listen. Hola, amigos, and welcome to the very first No Pain podcast episode. My name is Coach Darwin, and I am a physical therapist. And the purpose of this podcast is to really bring you true stories of humans who are dealing with pain or have overcome pain. I hope to really educate you, empower you that you can get better, and hopefully entertain you along the way. So I'm very excited to have as my very first guest, my favorite person in the world. This is Martina. She is my wife, and I thank her for all of her patience and time and going along with my crazy ideas. Thank you and welcome to the show.
Thank you. It's a pleasure. Thank you for having me.
Absolutely. I couldn't think of a more appropriate person for our very first episode. Okay. So a little bit of background. We are living in the Yucatan Peninsula in Mexico. We've been here for almost 5 years. We had a very different life in the past in Los Angeles, where we were both physical therapists. Now, my training and experience in physical therapy was primarily sports and orthopedic. Yours was very different. Do you want to tell everybody kind of what your role was or your experience was as a physical therapist while we were living in LA?
Sure. My practice centered mainly around women's health. My expertise is in prenatal and postpartum physical therapy, as well as pelvic pain and pelvic floor dysfunction. So my practice was very women-centered and women-focused. Again, we started with the focus on prenatal and postpartum physical therapy and recovery after birth.
And I would say this is probably something that's much more widely accepted and treated now. But when you got started, what year might have that been?
2008?
It feels like probably about 6 is when we started, which was, very kind of unheard of. Mm-hmm. Certainly in our neck of the woods, nobody was doing that. And you kind of took that mantle. And I would like to say that she is really one of the pioneers in the movement of women's health, but from very humble beginnings.
Very humble beginnings. Yeah.
Right. So in my clinic, when I was practicing with patients, I would do a lot of post-operative ACL work to get the athlete back on the basketball court, or low back pain, a lot of orthopedic type conditions. So a lot of soft tissue mobilizations, joint mobilizations, strengthening, stabilization, balance, a lot of exercise focused activities. What kinds of things were you seeing in the women's health clinic or treating?
Right. Starting with the prenatal support, we see a lot of musculoskeletal syndromes, as well as the woman goes through the changes throughout those 9 months of pregnancy. That is more musculoskeletal, more along the orthopedic lines, as you just mentioned within your clinic. Then as we approach the postpartum recovery and postpartum rehabilitation period, there were it's a lot broader ratio of diagnoses. Now, not only do we have the bodies recovering from the birth itself, now you have human beings carrying tiny human beings all day, nursing, holding, and taking care of a newborn infant while you go on zero sleep, and having to take care of the whole body, not just the one thumb that now starts to hurt. There's a whole bigger picture surrounding that. So we address that.
I'm sure all of the moms in the audience can relate to this picture that she's painting. And I know there's an emotional component to that patient population as well. How did you support your patients while you're addressing the physical components of the tissue stresses and inflammation and things that they're dealing with. And how did you carry that to provide the emotional support while the patient's on the table?
Oh, well, we do this or did this every day, all day. I think with 99% of our patients, that was I want to almost say as an important of a component as the physical healing that we could provide with our expertise and the tools we have in our tool bag, right? We had the luxury to be able to spend a little bit more time with the patient, the therapist, or also the assistants that work with us. And what I mean by that is to be able to sit next to someone and just listen. And there were many sessions where I did not even lay a hand on a patient, when all that was needed for that patient at that moment was someone to listen and speak to and be listened to, and just a hand on a shoulder and a compassionate heart to listen to what's going on, and then we cried. And that was okay. And I think that was very cathartic in many ways. And this little nugget, although I need to make sure to preface this, that we are not, that's not my expertise. We are not no therapist or psychiatrist in any way to diagnose or treat any conditions that we might see in that facet of life, but we at least could sit and listen and hold space for these people, and that was often as needed as the manual touch to the muscle.
How in the world are we going to get insurance companies to reimburse for therapeutic tears in physical therapy?
That would be a great ICD-9 code. I think we should make it all.
Right. But isn't that crazy that, in this day and age, I still feel that even physical therapy, let alone the entire medical landscape, is really just missing the boat on what true healing is. Yeah. And, guilty as charged. We would go in and really find the root, in the orthopedic world, we'd find the root cause of the problem, not just addressing the surface level symptoms, but going after the physical component of the problem, address that, fix that to become a more functional athlete or human body. But we didn't really delve into the emotional aspect, which is much more front and center with your patient population.
Right.
For those in the audience who this may be a kind of a novel concept with the pre and postnatal population, is there anything that you could tell those people who might be watching or listening, what challenges that they might be currently going through with a pregnant body, or can anticipate having as they go through a 9-month pregnancy?
A lot.
How long do we have?
It's a lot. What challenges? Well, there's a lot of physical, obviously, challenges.
Speak to those.
The challenges of a change in your body, a change of your center of mass, and a change within the hormones during the pregnancy, and the effect that has on ligamentous laxity, et cetera, that can pose, of course, a slur of physical ailments that we treat kind of along your orthopedic. We can check off the low back pain and the sacroiliac joint dysfunction, and we can check off the sciatica and such. And we do that, obviously, and we treat that. And we help prepare the clients and patients by strengthening their bodies and helping them with postural adjustments, and depending on their jobs, and are they sitting all day, are they standing all day, what do we do? So we help support that aspect, the ergonomic aspect as well. But again, I want to stress it. I think it is a very holistic, multi-faceted approach to pregnancy and postpartum recovery and pelvic pain and GI distress, where it goes way beyond the physical diagnosis of this particular pain syndrome.
Which should be normalized.
Right.
In today's healthcare.
We're getting there. Slowly. Very slowly.
Well, thank you for all of that background information, and maybe you and I should maybe sit down for a longer time and talk a little bit, get more in depth into the actual challenges, more specifically, and provide a little more a little more color around that. But today we're here to talk about your pain. So do you want to tell the audience kind of what we're talking about with you today?
Sure. It has nothing to do with pregnancy
Thank
or
God.
the pelvic floor. So it is further south. I injured my plantar fascia while playing tennis a little while ago, and it has been a long road to recovery.
So just to back up, because we might get into the weeds with physical therapy speak here.
Okay.
The plantar fascia is a very strong, very dense connective tissue on the bottom of your foot that attaches to the calcaneus or the heel bone and then fans out in kind of a triangular pattern to all of your toes. So what it does is it creates kind of the arch for the foot. It also protects a lot of the blood vessels and muscles and nerves that pass deep to it. So it's very, very important structure in the body. And that's the plantar fascia. So when did you injure it?
I want to say 6 months ago, at least.
Okay.
Or 6
So
or
we're
7.
talking, I think, October of 2023.
Right.
Okay. How did you injure it specifically?
During a tennis match or session, I crossed over in front of my body, ran for a ball and a backhand, and I felt a sharp pain that knocked me on the floor.
Did you feel anything tear, pull, pop?
No pop, no pull, no tear, only a sharp searing pain at the heel, near the heel of my foot. And I knew immediately what it was, and I knew exactly that I'm in trouble, and I knew not to step on it from that moment.
Okay. So then walk me through the next hour. After you planted, you twisted, you felt a sharp pain.
Yes. And
where did the pain go from there?
It went from 0 to 10, 12.
No.
And I knew I knew I tore something. I didn't know quite exactly at that moment what it was. It was extremely painful. I could not plant my foot. I could not step on it. I could not walk on it. Well, I denied all of this to my trainer, who was so kind to offer me some help. Do you need help? What happened? I said nothing, like a good therapist. I denied all of it and did not. I don't know why. Why do we do that? I didn't want the help. Mm-hmm. Another podcast on that. So I hobbled off the court, just barely touching my toes. I could not weight bear. My heel could not touch the ground, and I hobbled to my bicycle, and then I biked back home to come crying to you.
Mm-hmm. Right. So, again, sidebar. As physical therapists, it's pretty easy for us to diagnose this as a tear of the plantar fascia. A lot of you maybe have found this video because you're searching for help for plantar fasciitis, which really is just more of a chronic inflammation of your plantar fascia. So the tissue that I was describing just becomes inflamed. And you'll really know this if you step out of bed first thing in the morning, you have this exquisite sharp pain in your heel, you probably got plantar fasciitis. So I just want to be very, very clear that what Martina is experiencing and currently going through is not plantar fasciitis. But I will have a companion video shot to give you kind of a better understanding of plantar fasciitis, including some exercises that you can do to help get you out of pain and get you feeling better. So let's go back to, this is more of not a complete rupture of the plantar fascia, it's a whole other animal. And completely, this is a tear of some of the fibers in the plantar fascia. So you had extreme pain. Tell me about management on that first week after tearing that tissue.
Rest, ice, crutches, non-weight bearing, boot.
Wearing a walking boot.
Yes. And I remember you telling me, I said, because a whole week, not weight bearing and with the boots, I said, ooh, how long do I have to wear this? And you were so kind to lie to me with the best intentions, to tell me that probably a couple of weeks. I said, okay, maybe a couple of weeks. But you think I'll be back on the court, right? In about a month? And I don't think you answered. So I thought it would heal. I would be out of this a lot faster than the actual recovery ended up being, or still is.
We knew, maybe you were in denial. I knew
Total denial.
that this is a long recovery. This is not not a bad injury. I mean, I don't even know if I should qualify bad or good, but it's not a very serious as some ligamentous injuries or some other things can be. But I know this is a long road to recovery, and frankly, one that doesn't get a lot of sympathy for those people who don't know that. So for your friends who are playing, all they saw was an injured foot. Now, why aren't you back on the tennis court the next week?
Right. I didn't twist it.
Right.
I didn't roll it.
There's no blood.
There's no blood.
Yeah.
There's no swelling. No. I mean, there is, but not visible to an bystander. So they couldn't comprehend at all why I wasn't back on my team playing for months and months and months and months. And that's very true. People don't give it the credit it deserves, in terms of the recovery, the length of the recovery and the intensity of this particular.
It's also something that most people can't relate to. If you have a crick in your neck or your low back is sore or tight, it's something that everyone can have a kind of a historical reference and say, oh yeah, my back hurt and it hurt for 2 weeks and then I was back to doing my normal activity. So this is something that's not a common injury, I wouldn't say.
No. And I still don't know why it happened and what was what predisposed me to have that injury. As you speak of plantar fasciitis, I had no symptoms of any stress to my plantar fascia. I had no pain with walking in the mornings. I had nothing. I had only that day in that particular game or in that tennis match, I started to feel a cramping sensation under the sole of my foot, almost kind of like sometimes you get that during swimming or so, right? And I thought, that is different. That's new. I don't know why is that. I didn't change shoes. I didn't change, my racket. There was nothing new to my routine. So that came out of nowhere with a cramping sensation. I rolled it on a tennis ball, thought I can stretch it out. And the next session or the next match I was up, boom, I felt this acute, tearing.
That was it.
Came without a warning.
So how does a physical therapist rehab her torn plantar fascia? Tell me about your routine.
My routine. So the first at least 2 weeks, I was on crutches with a walking boot, non-weight bearing. We did a lot of ice. We did infrared therapy on it. And I think that was all we did for the acute phase. After a few weeks, I got rid of the crutches. I could, in the boot, because it was a very soft, squishy padding inside, I was then finally able, after, I don't even remember, at least 2, maybe 3 weeks, without being able to even touch my heel, non-weight bearing, just touching it to the floor. I think then I started to be able to walk a little bit with the walking boot. Again, we did nothing but rest mainly, right? Rest and ice and gentle. Stay off of it and gentle. I don't even think we stretched for a long time. Once we segued into the more subacute phase, maybe around week 6 or so, I was off crutches and we started gently to do some passive stretching. And I slowly started to do a little bit of soft tissue and fascial stretches to the bottom of my foot.
How did you do that?
The first thing we used was a gua sha. It was one of these jade stones that you can use to work on the tissue and especially the fascia to mobilize that gently a little bit until I felt comfortable to use something like a lacrosse ball to roll the sole of my foot and the plantar fascia gently roll it on the ball a little bit without re-irritating the injury site.
Right. Yes, it is quite a long process.
It is
to get to where we are today.
Right.
Now, where are we today?
Where are
What
we?
percentage better would you say to getting back to where you were the day before you injured it, say?
I want to say around 70%. I can walk okay. I have pain now in the morning, like a plantar fasciitis, as the tissue tightens and shortens overnight. I cannot walk barefoot very well. We have hard floors here, so I need to have a shoe on at all times that gives me the little squishy support and takes off the pressure off this particular injury site near the heel bone. I have now finally gotten back to tennis very gently. We're playing just a few times, and I'm very grateful that I can play without having a lot of pain afterwards. However, it's literally me standing and returning the ball. I have not been able to wear high heels very much because of the angle. None of that feels good, or any harder shoe. So I have to still be very mindful of what I wear and how many hours I'm on my feet. So better, but not at all near my running or tennis routine.
Right. So the key is really kind of dosing the amount of time you're on the court and dosing the amount of time that you're on your feet.
It takes a very patient person.
Yes, an unpatient patient. So, one thing that we've touched on earlier with your patient population is kind of the emotional and psychological toll that injuries play with everybody.
Right.
Can you speak to that with this particular foot injury? What kind of impact has that had between your ears?
Obviously, this is my subjective opinion, and my feelings is that I do not like to sit still. I'm a very active person. I've always been, and for me to be on crutches and being told to get off my foot and be on the sofa all day, although it might sound tempting for a minute, but it gets really boring after one day. So that combined with I am in midlife, so I feel the realization that tissues can break down, and again, knock on wood, I've been very lucky in my life to not have had any injuries, or not many at all. This is kind of something that brings to mind that tissues can wear out, and the older you get, the more susceptible you are to injury, unless you strengthen and stretch and do all the right things. Another podcast, yeah? So it kind of troubled me, and again, I don't want to say I got depressed. This is way too strong of an emotion, but it was kind of a sadness that accompanied this injury, and the lack of my social outlet in terms of meeting my friends for tennis, and a lack of my running outlet that gives me just energy and gives me the hormonal release that brings me joy and happiness. And lacking all of that, even 13 seasons of Peaky Blinders cannot combat that. Although that was kind of fun.
Yeah, it's not nothing. It's not nothing.
Yeah.
I think it's important, and one of the messages I really want to get across to the audience is that you're not alone in feeling these ways, and really honor these feelings that you're having. And while you're addressing the tissues that may be damaged, you also want to give yourself that time and that compassion to really address whatever negative emotions or feelings are coming up around that injury. I think it's really important that is discussed and that there is an outlet.
And I think there's a lot of healing that goes on, not only physically, but if the universe puts the brake on you and says you must stop running and doing and managing and creating whatever it is you do, the all day long, and it puts the brake or pumps the brake and forces you to sit still. There's a lot of that comes up, right? So that's a good time to become reflective a little bit, and also think about, maybe rethink things. I mean, in everyone has a different story to tell, but I think it's sometimes good if we are forced to slow down a little bit, especially if you live in an environment that is very fast-paced, or you have a lot of plates that you are juggling in the air, to slow down for a minute and just really think about it, and allow your body this time, to give your body this time to heal, and ask for help and ask for support. And I know not everyone is as lucky to have a personal physical therapist professionally at hand at all times, but still to just allow yourself that time to rest and heal.
I think that's a great place to end this. I think that's a great message, and if there's, if the audience can take anything away, I think that's it. Well, thank you so much for your time and for agreeing to do this crazy thing with me. I hope that we have the ability to impact more lives in a way that was different than our clinical practice. So again, thank you so much for being a part of this. And thank you all for watching and going along on these rides. I hope to be able to bring you a lot of different guests with different stories and different backgrounds. And I hope you find it as interesting as I do. So thanks for watching. Hasta luego. So I hope you were able to get something out of that interview. If you're currently having foot pain and you're looking for some exercises to do to help you recover, I'm going to put a link right up here. I've shot some videos about some of the exercises that you can do if you're experiencing plantar fasciitis to help you get back on the road to recovery. And I've also got another video where I go through it in long form. So if you want to go from start to finish and work out or recover with me, I've got that available here as well. And if you really want to get into it and go more in depth, I actually have assembled an ebook or an e-guide that walks you through all of kind of the causes, and then walks you through a 3-phase recovery program, all with exercise videos. And I'll put that information down in the comments below. So until next time, see you guys soon.